All right, Section 7, First Aid. Definition of the requirements. First aid is the immediate the temporary care given to the casualty before they can be treated with the professional medical personnel. The firefighter is controlled, confronted with mainly with the causes of bleeding, respiration deficiency, shock of the fracture, burns, and wounds. In all cases, the uninjured must be assured of the competency with administering with the first aid. The victim must be kept lying down and warm and the blanket under him, if possible, without the danger of fire and danger of injury, comfortable as possible. 455 short distance transfer. The victim must be moved with the safety and he should be pulled with the direction of the long axis of the body of his body, not sideways. The danger is left in the blanket. Similar object will be placed beneath him so that he can be dragged with the blanket. If the person may be lifted with the safety becoming the check for the injury that can be carried, made the carry should be tried to protect all the body parts before the tension of the lifting is discussed in paragraph 47 and 447 through 452. 456. External bleeding. Several bleeding hemorrhages may be caused by death within minutes. Therefore, it requires immediate attention, causing shock of the degree of which depends on the severity of the injury on the temporary of the injury made. Most bleeding can be stopped with applying the direct pressure over the wound, and some of the wounds may require the pressure of vessels which supply with the body part, or blood vessels which supply the body to the part of the body that may be injured. Direct pressure. Place open the first aid, pressing over the wound, the pressing down, the pressing of the compress of the blood vessels, the reduce the blood flow, and also help with how the blood in the wound until it clots. In addition, with the measure of the aids with controlling bleeding from the arm and the legs to evaluate the injured limb higher than the rest of the body. Caution: if there's no suspected fracture of the arm or leg, if there's a suspected fracture of the arm or leg, do not raise the injured limb until it has been properly splinted. Digital pressure. If it may be necessary at times to apply pressure for supplying blood vessels to reducing bleed. If the blood is spurting from the wound, the digital pressure can be used to control the bleeding until the pressure dressing under the wrap applied with the digital pressure is applied with the fingers, the thumbs, and other hands with the pressure point. The pressure point is the site of the blood and main artery supplying with the wound area near the skin over the bone. And by pressing on this point of the flow of the blood through the heart of the wound is shut off with the least to slow down the two most essential pressure points, knowing the R, each, and E and H for the figure 482. There are main points for the which bleeding of the extremities can be controlled. Pressure points from temporary control of the arterial bleeding. Starting out with the wound will template scalp with the wounded lower face, wounded shoulder, upper part of the upper arm to the wounded neck, the wounded lower upper and upper part of the arm and elbow through the wounded wound of an arm, wound of a hand, wound of a thigh, wound of a thigh, wound of a foot, wound of a lower leg. Turn-X are band placed under the arm so they tightly compressed. The hooks of the arteries should be used only if the pressure over the wound is elevation pressure. On supply blood vessels fail to control the bleeding of the tourniquet does not stop the bleeding immediately. When the tourniquet is needed, it must be applied promptly and properly. 1. If the regular issue of the tourniquet is used with the buckle to suit adjust with the figure 483 with the strap hold down toward while the injured part of the steady of the issue of the tourniquet is not available to belt and tie the rope of the handkerchief that is used instead of the strap. The improvised the bands are tied around the arm and the leg twisted with the stick of the shown in figure 484. The tourniquet must be drawn up tightly. For the bleeding of the arm and the leg, never applied with the tourniquet over the bony parts such as the wrist, the elbow, ankle, and the knee. It is more efficient when they apply with the fleshy parts such as the thigh, upper arm. The tourniquet should be applied so that it closes the possible edge of the wound. One of the tourniquets has been applied to the wound body should be seen at the doctor as soon as possible. The tourniquet should not be loosened by anyone except the medical personnel. The tourniquet has been applied with the casualty with the time of the application should be written on or near the tourniquet. Alright, figure A shows A and B and C and D. A wrap twice around the arm, and then half, tie half and the knot, and then place the windlass over the half knot. Finishing the knot, turning with the windlass, tightening, securing the windlass with the tails of the tourniquet. 488 shows the regular application of a regular issue tourniquet. The lungs with breathing obtain medical care immediately. 458, artificial respiration. Knowledge of artificial respiration is essential for the firefighter. Large fires sometimes trap people in smoke-filled body buildings. If the two firefighters are themselves likely the victims of smoke inhalation, thus becomes the duty of the firefighters to know and apply artificial respiration. B. The artificial respiration is administered by non-breathing victims. Electrical shock, drowning, gas, poisonous respiration, depression, drugs, morphine, opiums, barbiturates, alcohol, compromise, impression of the check caused by the whole building of the collapse, the cave-in, victims choking and strangling particular objects with the passages. Artificial respiration must be started and promptly after the nominal respiration ceases. Most persons die in approximately 6 minutes after breathing stops and unless artificial respiration is administered. Artificial respiration must be administered manually. The mechanical method for the manual method is necessary. It may be mouth-to-mouth method, the back pressure arm lifted, or the back pressure hip lifted method. The method of artificial respiration also keep the following general principles in mind. 1. The time to prime the importance. Do not delay artificial respiration to loose the clothing to warn the casualty. Give stimulus must important to give the air the casualty of the lung. To quickly sweep the finger through the casualty's mouth to clear out the froth or debris for the draw of his tongue forward. 3. Position the casualty properly in order to maintain the open airway. Tilt the head as far as back as possible in front of the neck and stretch in the chin and the junting out position. Do not allow the chin to sag. 1. Open check the mouth for debris. 2. Open his mouth. Begin artificial respiration. Continue without interruption until the casualty starts natural breathing and pronounced dead or is pronounced dead. A smooth rhythm is desirable, but second timing is not essential. 5. If a casualty begins to breathe on his own, adjust the timing to assist. Do not fight his attempts to breathe. Synchronize your efforts with his. As soon as the casualty is breathing for himself, additional help becomes available. See that his clothing is loosened or removed from if wet. Then he is kept warm and is being treated with a shock. All right, 459 mouth to mouth thumb jaw lift method. Place the casualty on his back. Do not put anything under his head because it may flex the neck, cause the air passage to be blocked. Quickly clear his mouth of foreign material running with your fingers behind the lower of the teeth over the back of the tongue. Wipe out any of the fluids, vomitus, or mucus. See if it's available for the rolled blanket and some of the other similar material under the shoulders so that the head will drop backward, the head back so that the neck is stretched, but the head is in the chin-up position that aligns with the air of the passage so that they do not become blocked by the kicking pressure. D. Place your thumbs in the corner of the mouth with the grasp of the lower jaw. Firmly lift the lower jaw forward and pull the tongue forward out of the air passage. Do not attempt to hold the tongue and close the nostril with the thumb index finger. Step 3, figure 485. Put the cloth over the victim's mouth and nose. Breathe through it if you do not wish to come in contact with the person. Take a deep breath once the mouth is wide. Take the seal breath. Seal the mouth around the casualty mouth. Your mouth is below the forcefully, except for the infants and small children, is into his mouth until he sees the chest rise. If the chest does not rise, hold the jaw up more forcefully. Blow harder while making sure that there is no blockage of the air pressure, no air leakage around the mouth of the nose. F. When the chest rises, stop blowing. Quickly remove your mouth from his and take another deep breath while listening to the exhalation. If the exhalation is noisy, elevate the jaw. When exhalation is finished, blow in the next deep breath, but the first of 10 breaths must be kept, except for the infants and small child, at a rapid rate in order to provide with the rapid reoxidation. Therefore, continuing breath at a rate of 12 to 20 minutes until the casualty begins to breathe normally. Excessively deep and rapid breathing may cause the user to become faint and even loss of consciousness. 8. After performing the rescue breathing, and for a time, you may notice the casualty's stomach and then bulging. The bulging is due to the air being blown into the stomach instead of the lungs. Although the inflammation of the stomach is dangerous, it makes the inflammation of the lungs more difficult. Therefore, when you see the stomach bulging to a marked degree, you apply the gentle pressure to the stomach and then which your hand between the inflations. Remember to keep the air passage clear of the fluid and the obstructions as possible. Several sharp slabs between the shoulder blades usually dislodge the foreign material. Keep the head back and the neck stretched and the chin pulled forward, ready just position. If any of the air does not flow freely in or out of the casualty, do not breathe too forcibly too large of the volume. If a casualty is an infant or small child, the infant seal both the mouth and the nose with its mouth over the mouth, or blow small puffs of air from your cheeks rather than blowing from the lungs. If you become distressed, the rest of the shallow breaths interbit the blow long enough to keep the deep breath without resuming the blowing. Alright, 460, mouth-to-mouth, two-hand jaw lift method. This is an alternative method for using clean atmosphere with the casualty jaw, as are slightly closed but the thumbs cannot be inserted. Place the casualty on his or her back, clear the mouth as possible, position the head in the chin-up position, grasp the angle of the lower jaw with both hands just below the earlobes, lift the jaw forcibly forward to pull the tongue forward out of the air passage, lift the lips are closed, push the lower lip toward the chin with the thumbs. Take your deep breath and open your mouth widely set. Seal your mouth around with the casualty's mouth pressure. Shake against his or nose and prevent the air leakage. Blow forcibly into his mouth until you see the chest rise. 461, mouth to nose method. This alternative method is used to clean the atmosphere. Neither of the methods above can be used. For example, the casualties are several jaw spasms with wounds of the jaw or mouth. Place the casualty on his back. Clear the mouth if possible. Position the head with the chin up position. Grasp the angle of the lower of his lower. Step 1, clearing the vomit and other things out of his face. 2, tilting the chin back and applying over the nose and the mouth. Mouth-to-mouth, two-handed jaw lift recitation. Mouth-to-mouth nose recitation method. Alright, jaws with one hand just below the earlobe, the labs, lift the jaw forcibly forward, the figure 487. Seal your other hand over the casualty mouth to prevent leakage. Take the deep breath to open your mouth and seal your mouth around the casualty nose and blow forcefully until the seas of the chest rise. When the chest rises, step the blowing quickly, remove the mouth from the nose, take another break and listening to the exhalation. 462, chest pressure arm lift method. The preferred method for the contaminated atmosphere. Place the casualty on his back and with his arms folded over the chest, quickly clear his mouth of any foreign materials running with your fingers between the lower teeth over the back of the tongue. Wipe out any fluid or vomitous mucus with any of the contaminated areas. Casualty is not already masked. Put his mask on. If already masked, quickly remove the mask and wipe away any of the fluids that may be collected in his mouth or in this mask. Replace the mask. If available, place a rolled blanket and some other similar material under the shoulders so that the head will drop backward. Tilt his head back so the neck is stretched. Head is in chin-up position. If possible, keep the head in the position since the A lines of the air passage so that they do not block the kinking or the pressure. Alright, D. Kneel on either knee of the casualty's head, placing your knee at one side of his head and placing your opposite foot at the other side of the head. To take the casualty just above the wrist of the place for over the large case. Take the casualty arm just above the wrist, place them over the lower ribs, rock forward in extremely steady and uniform pressure, almost directly downward until you meet the resistance. The pressure forces the air out of the lungs. Immediately release the pressure and pull the arms outward and upward over the head and backward as far as possible in 488. Lift the step 3 in 488. Over the arms, increasing the chest and the size of the draws and air in the lungs. Slowly replace his arms of the chest and repeat the complete cycle to about 12 times of the minute with the rhythm of 1 press, 2 lift and stretch, 1 press, 2 lift, 3 stretch, and 4 release. The release should be abrupt. If you become tired and uncomfortable with one knee, you may quickly switch to another knee. If more comfortable, you may knee on both knees, although the forward and backward motion is easier to maintain while the knee on one knee only. Checking the mouth frequently, the obstruction of vomitus, mucus, and blood obstruct with the air passage to keep the victim's head extended with the turn on one side. Figure 123 shows the chest pressure arm lift method. J. The second man is available to make the over-the-chest pressure arm lift, the particular no break in the rhythm there is done, but the first man can move off to one side while the replacement comes in from the other side. The second man is ready for the casualty's arms and release during the stretch of the new operator task. The operator takes them and continues in the same rhythm. 463 follow-up care and artificial respiration. When casualty breathing normally, wrapping him in the blanket, he should remain laying down until he is seen by a physician and recover the semen assured when he is conscious and given him a warm drink such as coffee or tea. Alright, shock. Although several types of shock is one with the firefighter is chiefly concerned with the traumatic shock. The depressed condition of the manning of the body functions is caused by the failure of the blood to circulate through the body of the following of the serious injury. The traumatic shock may be result of the injury to be body tissue for the burns, wounds, and fractures. In most instances, result of loss of large area quantities of blood, either externally or in the tissue of the body cavities. In general, the greater the damage to the flesh of the bone, the more or less the blood, the greater the danger of the shock will occur. The victims of the shock might be handled with greater care, but through the handling may have fatal result of a serious injured victim is susceptible to the shock and must be handled accordingly. Symptoms of shock. The most important evidence of the shock of the victim's weakness is coupled with the pale skin which is moist in color than normal. Beads of perspiration may be noted about the victim's lips, forehead, palms, and arms pits. He may complain of nausea. His mental reaction may appear normal at first, but will later be alertness and interest in the surroundings. He must be likely to be thirsty. 2. The pulse of shock is rapid and may be weak with the difficulty to detect breathing and faster. The usually occasional deep of the breath is in case of several hemorrhages. These signs may not be evident at first, but develop after an hour or more. Whether there's doubt of giving the first aid treatment of shock, the same first aid treatment should be used with both preventing the care of shock, keep the victim lying down, the permits the greater amount of blood to the flow of the head and of chest. It also is most favorable position. These injuries, internal organs are or the head, or where there is evidence of fracture. If the victim has difficulty breathing, his head of the shoulders should be evaluated. There is no difference in breathing. There is no head injury. The lower part of the body should be elevated to the aid the blood of the head of the chest. So place the blanket beneath the victim and necessary cover him with another. Keep him warm with just warm enough water comfortable. Never use the hot water bottles, heating pads. Except in very cold weather, then with care. The overall principle of applying heat to the shock victim does not add heat, simply prevent the loss of body heat. If the victim is conscious and if there is no sign of nausea, stomach, or hemorrhage, of the few sips of the water may be given to him. If there is a delay of obtaining medical service, 1/2 a glass of water with a half a teaspoon of table salt with a half a teaspoon of baking soda per quart, or 0.946 a liter of water, given at X amount of minute intervals required. Recommended with fluids may be given in stimulants such as ammonia, coffee that have no value in treating traumatic shock. Do not forget that giving attention to the injuries of the shock victim also conform and encourage him. 465. Electrical shock. Electrical shock accidents frequently result from the contact of a live wire, occasionally occur with a person struck by lightning. If a person has come into contact with electrical current, with the turn off of the switches nearby, do not waste in taking time looking for the use of the dry wooden, the dry clothing, the dry rope, and some other materials which do not conduct electricity. Remove the person with the live wire. Do not touch the wire casualty with the bare hands. Electrical shock causes the breathing to stop at the start of artificial respiration immediately after freeing the person from the wire. 466. Fractures. Broken bones are simply compound, or either simply compound fractures, simple or compound fractures. Simple fractures also close with a fracture because the broken bone has not pierced the skin and causing no external bleeding. A compound fracture, sometimes referred to as open fracture, is the broken bone that has been pierced with the skin. Signs and symptoms of the fracture. The following are the indication of the bone is broken. 1. Tenderness over the injury with the pain over the movement, inability to move the injured part, unnatural shape, the deformity before the swelling, the discoloration. Treatment. If you think the person with the broken bone handling with great care, rough the care, this handling causes the pain and the increase of the chain the stock. Furthermore, the broken ends of the bone air or razor sharp and can cut through the muscle and blood vessels, nerves, and skin. Remember to do not move the casualty fracture unless it is necessary. If you do, gently keep the fractured part from moving. If the wound is with a fracture, apply the dressing as you would with any other wound. If there is bleeding, use the first method of stop breathing. Use first aid method for stop bleeding. C. Splinting. All fractures require splinting. A person with a fracture of long bones or other bones of the pelvis and back neck should be splinted where they lie before they are movement and with the transportation attempt the proper. Splinting gently relieves the pain of the fracture, often prevents the lasting shock. Fixing the fragments of the broken bone with using split prevents the jagged edges of the bone from tearing blood vessels and nerves. The proper splinting of the closed fracture will prevent the bone from piercing the skin. Casualty fracture of being an open one. The proper splitting of the open fracture will prevent the further injury to the wound. First aid for the field may require to improvise as splints for whatever the material you may be handed with the tree with limbs, poles, rifles, cardboard, rolls, newspaper, magazines, etc. You should remember that the splints should always be, especially where they come from the contact with the bony parts such as the elbow, wrist, knee, and the ankle joints. Leafy vegetation can be used to supplement pieces of clothing using splint padding. 1. Splints and fractured bones of the legs and the thighs and hips. To splint the fractured leg of the roll and the roll sticks other than support of the solid blankets, other padding material through the form the padded through in which the rest of the injured binded splints firmly in several places above and below the break. Splints of the leg of the fracture should be extended with the point above the knee of the lift. Little of the below the foot of the in case of the fracture. In case of the fracture, the hip of the thigh or the hip of the whole blankets may be used with the splint, as long as the except the inside of the splint is extended with the crotch little below the foot, with the outside of the splint extended with the arm of the little below the foot. The armpits of the crotch must be well padded. The quick way to splint a broken leg is to tie it in casually uninjured casualty's uninjured leg. Padding it placed between the person's legs and the legs are tied together in several points above and below the fracture. The casualty's feet and should be tied across the arcs and toes. 2. Splints and fractured bones of the arm, and keeping the fractured bone from the arm removing by the supported with the splints, reducing the pain. Prevents the damage of the tissue. Temporary splints can be made with the board branches, the folded cardboard, magazines, newspaper. A good general rule for remembering splitting a large bones or length and thigh, the forearm, and upper arm. Is to have a splint long enough to extend above the joint above the fracture to below the joint below the fracture. The splint should always be padded with some of the material to protect the limb from pressure of the and rubbing. Bind splints securely with several points below the fracture, not lie tightly enough to interfere with the flow of the blood. It will apply to 2 splints, one either side of the arm, and injured with the elbow. Do not try to straighten it straight and do not try to bend it. Figure 493 shows the example of the splint correctly applied with the forearm, upper the arm, the elbow to support the fractured bone and to prevent this from moving. In figure 493, the padding of the splint has been omitted with clarity. The sling is the quickest way to support the fractured bone of the arm and shoulder, a sprained arm, and an arm of the painful injury. Arm should be bounded snugly to body to prevent the movement. The sling using a material that would support all the portions of the lower body and hold it in case close to the body. Figure 494. A broken back. Let's see. This shows the leg splint improvised with a blanket and pole. Sprint applied with the fractured leg and the knee. Improvised the leg and thigh and hip splint. Expedition leg splint. Tying the legs together. Alright, broken back. If it's possible to determine whether the casualty has a broken back, especially with the back injury, especially if the back has been sharply struck or if the casualty has been fallen, if the casualty has received an injury but he lacks the feeling with the legs or lacks the ability to move, you can be reasonably sure that they have severe back injury which is instructed to be treated with a fracture. You must remember that there is a fracture of the sharp of the bone and fragments can cut the damage in the spinal cord and cause permanent paralysis. 1. Procedure for handling spine fracture casualty. Place a lower roll such to the bath towel with the clothing under the middle of the back to support it. Lift casualty if he's moved the outer litter of the board without bending the spine forward. It must be best have to be the last 4 men with the job. If the casualty is face down position, he may be carried out the face down on the litter. Keep the casualty body in alignment with the straight natural at all times. Keep the air. Figure 494 shows the splint for the broken arm, wrist arm, the splint for the broken arm, and a straight splint for the fracture near the elbow when the elbow cannot be easily. From the turntail jack of the shirt up air and over the injured and end fastened in place with a pin or twig. You bend inside your chest and belt or cartridge best arm additional support and supporting the forearm with a sling made of belt and strap of clothing bend, binding the arm to the chest. In this position, bone fragments can cut the spinal cord. In this position, bone fragments proper place won't cut the spinal cord. See the placement of the pads underneath them. 495 position of the broken back. 496 four-man carry. The passenger free if the conscious is cutting him not. Causes do not move the casualty with the broken spine unless absolutely necessary. Raise his head even if for a drink, raising his head even for a drink, twisting his neck or back, carrying him with a blanket face up. Broken neck. A broken neck is extremely dangerous. Bone fragments may cut the spinal cord, just in the case of the broken back. They keep the casualty's head straight and the sill with the neck slightly corded. If his conscience caught him to move, the moving may cause his death. A broken back is protected with the flowers. Place the rolled bath towel roll with the clothing about the same bulk of the bath towel and under the neck and supporting the padding. The roll should be thick enough to arc the neck of the slightly. Figure 497. Raise the shoulder in order to place the roll under the neck. Do not bend the neck of the head forward. Do not twist or raise the head at all. Place the roll when the casualty is lying flat. The back of his head touches the ground to keep the head motionless after the roll is in place. Put in the large padded rock or pack at each side of the head. If the man must be moved, get help once the person should be supported with the means of the hand, keeping them straight while the others lift him. Transport his hard stretcher on a stretcher aboard. Never turn over the casualty who has a broken neck. 5. Fractured ribs. Fractured ribs cannot be splinted, but pain can be relieved, restricting the movement of the injured ribs. This is done by binding tight swath and muslin bandage around it. 497 shows the protection of a broken neck, the headgear around it after the pillow has been put in. This is an immobilization of fractural ribs with the crevettes. 4 shows the method of immobilizing clavicles. The chest applying with the 3 triangular bandage folded with the cravats around the chest. These are applied with the patient as the forcible exhale altered with the air in the lungs. Bandages are applied with tightly enough to give the support, not so tightly the may pierce the lung. The fracture of the clavicle with the clavicle or collarbone is fractured, but the break is easy to detect. The shoulder uninjured side droops down, broken ends with the down upward and causing the noticeable deformity. The arms on the injured side cannot be raised, but the patient is usually supporting the elbow with the opposite hand. The injured part of the immobilized temporarily by one of the following, supporting the arms and the triangular band. This shows the bandage of a fractured jaw. 8. Slinging of the arm slightly higher than the elbow, binding the arm to the chest with a triangular bandage, supporting the arm with the figure of each of the improvised 2 belts. Fractured jaw, supporting the jaw with a cravature bandage. Do not obstruct the breathing. Place a wad of gauze between the teeth of the back of the jaw to keep the jaw apart, to maintain the air passage and to permit the free draining of the air and drainage from the mouth. Alright, 467, burns. There are 3 kinds of burn: thermal, thermal burn, chemical burns. Burns are classified according to the degree of the burn, depth of the burn. First degree burn reddens the skin. A second degree burn is blisters the skin. A third degree is deep burn, when underlying the skin growing and the cells are destroyed. First aid in thermal burns. Victims of burns require treatment and shock relief from the pain. Preventing from contamination. Shock is a major hazard, usually serious, with the very involved. The 10% more of the burn in body surface, sometimes less, and especially deep third-degree burns. The exclusion of air from the burn of the application of the thick dressing relieves the pain, and if dressing is sterile, prevents the further contamination. At least 4 layers of the dressing should be applied. The covered with the clean, tightly woven material to exclude the hands must be thoroughly cleaned for the procedure of the burning extreme involved in the trunk of the large part of the extremity warm. Clean sheets and large towels applied around the part of the control. Covering the victim according with the weather and transporting him to where they can be attained with medical aid. Sunburn and chemical burns. Intensive sunburn requires sterile dressing, especially blistered chemical burns must be washed with a large quantity of water dressing with the sterile dressing according to the seriousness of the injury. Several chemical burns and sunburns require medical attention in proportion to the seriousness of the burns. 468. Heat stroke. Occasionally hot weather causes heat strokes. Whether the victim experiences dry skin, rapidly pulse, headache, he may develop dizziness, nausea, ultimately unconscious. The victim temporarily may raise 106 degrees Fahrenheit, sometimes as high as 109 degrees Fahrenheit. The afflicted person must be brought under cover, then clothed and cooled and sponging the body with alcohol, lukewarm water, but the patient requires immediate medical care. Section 7. Control, extinguishment, and overhaul.